Stress fracture of the heel bone. Are you feeling pain in your heel that won't go away? It might be more than overuse. It could be a stress fracture. In this video, we'll dive into what causes stress fractures in the heel bone, the symptoms you need to watch out for, and how you can treat and prevent them. Let's get started. The heel, or calcaneus bone, is located at the back of the foot, providing support and stability. This part of the foot can suffer a condition known as a stress fracture of the calcaneal and can occur in anyone. It is a tiny break in the heel of the bone which can result from many things. Calcaneal stress fractures are the second most common foot injury, constituting about 20% of the cases. Today, we'll explain a heel bone stress fracture and how to detect and treat the condition. Heel bone stress fracture explained. A stress fracture of the heel bone, or calcaneus, is one or more little breaks in the heel bone. The breaks can occur because of the repetitive and long-term stress of the heel bone. Although heel bone stress fractures are not that common, they can be extremely painful when they do occur. More often than not, a stress fracture of the heel bone requires the attention of a medical practitioner. This is because it typically causes intense pain and difficulty in walking and may result in several complications if not addressed or treated adequately. What causes stress fractures in the heel? Stress fractures in the heel region can occur when the body isn't allowed enough time to heal between strenuous activities. For example, if you run often or suddenly increase your activity levels, you are at risk of calcaneal stress fractures. Other causes of stress fractures in the heel bone include high-stress injuries from accidents such as car accidents. A traumatic twist of the ankle as well as falling from a high surface can cause a calcaneal stress fracture. In addition, runners and other athletes who place long-term repeated stress on their heel bone can suffer stress fractures. And lastly, wearing the wrong or inadequate footwear, calcium and vitamin D deficiency, and insufficient calories can also result in calcaneal stress fracture. Symptoms of a heel bone stress fracture. A heel bone stress fracture typically accompanies pain around or inside the heel bone. In the early stages, you may only feel pain when you carry weight, run, or do other strenuous activities. However, if you continue these activities, you will start feeling the pain even when you're not bearing weight, especially when lying down or sitting. Other symptoms of a calcaneal stress fracture include tenderness, swelling or redness in the heel or affected foot, limping or difficulty walking. Pain worsens the more you stand. It is intense on the heel and painful to the touch. Stress fracture treatments. Heel bone stress fractures are often treated without surgery, except in sporadic, very severe cases. Below are the most common treatments for stress fracture of the heel bone. Rest. The first treatment is to stop moving and take off or at least reduce the load on your heel bone. This means you must reduce your standing, walking, running, and jumping to a level where you don't feel pain. Crutches. If detected early, you may only need to wear well-cushioned shoes alongside reducing the weight-bearing activities for a while. However, if the pain worsens before you seek medical attention, you may need to use crutches or boots. Also, you may need to wear a cast or splint to ensure your foot stays in one place while the bone heals. Vitamin D and calcium. You may need to adjust your diet and nutrition by including more vitamin D and calcium. That may require you to consult a nutritionist, particularly if you suspect your diet is not optimal. Pain medication. Your healthcare provider may recommend pain medication or non-steroidal anti-inflammatory drugs, also known as NSAIDs. Physical therapy. After the pain has healed, you must avoid rushing back into those high-impact activities. Slowly ease into them instead. As such, consider working with a sports physical therapist to ensure you are ready for a full return. They can guide you with the correct strengthening and flexibility exercises for recovery and prevention. Surgery. In severe cases, especially when conservative treatment has failed, your podiatrist or foot and ankle orthopedic surgeon may recommend surgery. Surgery will typically involve using plates and screws to keep the fractured bone in place. Heel protection. Orthotic devices such as protective insoles and inserts can provide additional support and cushioning to the heel. Thanks for watching. If you found this video helpful, give it a thumbs up and subscribe for more insights on foot health and wellness. Do you have questions or experiences to share? Drop them in the comments below. We'd love to hear from you. Stay active, stay healthy, and see you in the following video.